Kabul Chakalakal pages, and today I will be presenting on the topic the role of probiotics in managing the irritable bowel syndrome. So this presentation includes a like a definition. We have already learned about the IBS, so I'll be just giving a definition of the IBS, and we will look forward into the how the probiotics works on the IBS. At the same time, I had researched on three articles. We'll be discussing the whole sum of the three articles, the conclusion from the three articles, and how these are effective, whether the effectiveness of these probiotics for the IBS syndrome. At this, also we'll be discussing the other factors like us, the consequences, the side effects, and we'll conclude the presentation. So all these are the things that I included in my presentation. So we will look forward to all these things. Like as I mentioned before, the topic is the role of probiotics in managing the irritable, like the bowel syndrome or the IBS, which I already mentioned. And this presentation is based on the current research or the researchers that has done already with a focus on how the probiotics can be effectively used as the therapeutic option for IBS. And I will walk you through the mechanisms, their effectiveness, and the practical recommendations based on several studies. So let's begin the session. Like it's like a small introduction that I would like to give you. So now we'll start the core portion of the presentation. For the convenience of you guys, let's start by understanding how probiotics can help in managing the IBS. So it basically, this slide discusses the functioning of the probiotics in the human body. So firstly, the probiotics can prevent the harmful bacteria from sticking to the gut lining. So all it starts is like in our gut, so it prevent the bacteria from sticking the gut line, and this helps in controlling the growth of these harmful bacteria. So they also strengthen the intestinal barrier, which is important because a strong barrier prevents unnecessary immune reactions that could worsen IBS symptoms. So these are the primary things that our probiotics does in the human body. And some probiotics also have the anti-inflammatory effects. That means they can reduce the inflammation, which is often associated with the IBS. So this way it's also effective, and they also help normalize the gut movements, which can reduce the bloating and also the discomfort without making bowel habits worse. So lastly, the probiotics can lower gut sensitivity, which helps reduce the pain that many IBS patients experience. So it's a great thing that it's reducing the pain. So these are the steps, or these are the actions that probiotics does in a human body to reduce the effects of IBS. So now let's discuss the articles that I have reviewed. So there are like three articles. Now we will review how these three articles help me in this research. Let's have a look on the first article. So moving on to how effective probiotics are in treating IBS. So that's the body of this article. So research shows that the probiotics containing multiple strains of bacteria are often more effective than those with a single strain. The clinical studies and reviews have found that probiotics can improve IBS symptoms, but it's not still completely clear which specific strain. Moving on to the next article, let's look at the role of probiotics in managing IBS according to another study. So, IBS is known for causing abdominal pain, the bloating, and the irregular bowel habits, and these symptoms can get worse with stress. So, probiotics can help by reducing pain, the bloating, and the gas, and by improving the consistency of stools. For example, strains like Bacillus coagulans can release, like they can ease the bloating pain, So let's dive into the third article, which discusses how probiotics work in relation to the biology of IBS. So IBS affects a significant portion of the population, especially women, and involves a mix of genetic, psychological, and the environmental factors. So probiotics help by restoring balance to the gut microbiota, strengthening the intestinal barrier, reducing inflammation, normalizing the gut movements, and maintaining a healthy intestinal environment. Well-researched stains include lactobacillus. This time we were discussing about the articles. We discussed like 1, 2, and 3 articles. So all these were discussing about how the probiotics are linked with IBS. So the main points we need to remember is the monostrain probiotic and the multi-strain probiotic. So when we talk about these two probiotics, it's evident that multi-strain probiotics has much better effectiveness than that of the single strain ones, even though they are not like the researchers which proves this is better, but still they have some like show greater efficiency than from the monostrain probiotics. And when we come to the clinical evidence side, it's like the role of probiotics in IBS. It's like it's supported by a lot of studies and even the meta-analysis, so it has great medical support. Also it's relevant that we need more researchers on this topic, just because it's not yet done. Like we need to learn more on this. It's also relevant to discuss about the IBS treatment. So now let's know like about how to incorporate probiotics into the IBS treatment. So it's important to choose the right probiotic. That it's very important. We need to choose the right one, considering the specific benefits. Each one have their own benefits, so we need to consider the specific benefits of different strains. Like for example, we can consider the Bacillus coagulans, which is good for relieving bloating and pain. So if one is suffering from bloating and pain, they should go for the Bacillus coagulans. And if someone is going like need assistance with the pain and urgency, they should go with the bifidobacterium, where the bifidum help with the pain and urgency. And the probiotics can also be consumed through the fermented foods like the yogurt and kefir, or as we can also take them as the supplements. So in clinical practice, it's very essential to assess each patient individually to see if probiotics are suitable option. Like each one have different nature and the medical condition will be also different. So we need to like we need to monitor like for the suitable option. At the same time, we need to monitor the effectiveness. Once the probiotics are given or taken, we need to monitor the things that are happening, like their effectiveness on their body, and also the making adjustments as necessary is also relevant in for this. So moving on to the next slide, we are discussing about the potential side effects and the contradictions. So whenever we are using something, it's obvious that they will be having a side effects. So while probiotics are generally safe, still there are some potential side effects that we need to be aware of. So there are like some particular conditions, like the common side effect are like the bloating and the gas, but these things are not like long. This time we were discussing about the how probiotics are connected or interrelated with the IBS. So to conclude, the probiotics have shown very significant promise in improving the IBS symptoms. That's what we understand from all these slides that we have gone through or we have come through. So especially when multiple strains are used together, like we know that the effectiveness are really good. So, however, the effectiveness of probiotics can vary depending on the strain and the individual. Like more research is needed to identify the most effective strains and dosages. So we need to do more research on for this purpose, as well as to understand the long-term effects of probiotic use. So in the future, the probiotics could become an integral part of personalized nutrition plans for managing IBS, offering a safe alternative to more conventional treatments. Finally, here are the references that I used for this presentation, and they include case studies and articles that explore the role of probiotics in managing IBS. So these sources provide detailed information if you are interested in further reading on the topic. I would like to add that thank you for listening for all this time, and it's my pleasure to have a presentation or to have an opportunity to present on this topic. Hope you guys enjoyed. Thank you. Bye.